bleeding in early pregnancy. So bleeding in early pregnancy, it makes you like very anxious, obviously, because you have been pregnant after a long time and you have started bleeding. So the bleeding might be due to several reasons. So instantly you have a spotting maybe after the embryo transfer, or after the embryo transfer you see blood. Sometimes many causes of this are maybe during the embryo transfer there was some injury due to the speculum, or there was some manipulation during the embryo transfer. That was the cause of this bleeding. So this kind of bleeding is not harmful because it is coming from the external area. Secondly, you might have spotting post embryo transfer. That is also fine because it might be due to implantation bleeding or any other minor things. Thirdly, you might be having it because of some problems of ectopic pregnancy or heterotopic pregnancy. So in that case, you need to see your doctor immediately. Thirdly, it might be a symptom of like early abortion or a missed abortion. So bleeding of any kind in the early parts of pregnancy is dangerous, and you should go and see your doctor immediately so that the doctor should ascertain whether this is a thing to be worried about or you need to be at rest. There's nothing to worry. But any kind of bleeding, if it happens after embryo transfer, you need to continue our medications, because many times what happens, the patient has small bleeding, it might be a threatened abortion, and then the patient stops the medicine. So that is very dangerous, because if you're stopping the medicines, then obviously it will lead into a full-blown abortion, because after embryo transfer you're given a lot of support, a lot of hormonal support. So please don't stop it. Just go and see your doctor, seek help from a medical consultant who will be telling you what sort of bleeding is it, whether you should be anxious or not. Many times a small infection also causes bleeding vaginally. So it's like, it's not necessary that you are bleeding that means an abortion is happening. So just keep your nerves cool. Just seek medical advice before you do anything, before you jump to anything, any conclusions, before you start crying, before you start taking stress, because that is very dangerous, because those hours of stress or anxiety, they are going to lead to much problem, because that is going to affect the fetus that is inside your womb. So you have to always believe that there are many causes of bleeding after your embryo transfer or in the first trimester, and all bleedings are not bad. They are not like going to be a bad omen, a bad thing for your baby. In many times it's just a sign, it's just a symptom that the body is throwing. Maybe the body is needing more progesterone. So in all these cases it will be like addressed by your doctor who is seeing you. So please don't be anxious. Early pregnancy bleeding doesn't mean that you're going to land into abortion. But obviously it's a matter of concern and you should see your doctor. We care about you.